Recent implant techniques were determined by approximately 30 years of research and development. Thanks to these, we may offer these methods and high level of science to all of our patients. The first and most important step is the appropriate planning. At this phase, we can define the number, axis, and size of the missing teeth. Furthermore, it is also essential whether the quality and quantity of the patient's bone is enough for starting the procedure. The second step would be the implantation itself. First, we must explore the gum, which we can manage two ways. Either we make a round piece by drill, then remove it, or we make an incision and after that we slowly separate the gum from the bone. The second method is used mostly at larger, more serious cases. When we are done, we mark the places of the implants with a round fraser. The next step would be to choose the adequate lengths and widths of the drills. We use the initial drill to make sure of the proper depths, and after that we slowly, step by step, widen the space with the nest drills. This way we are able to make a proper cavity for the implants, which would be only a little thinner than the screw itself. In our last step, we place the implant in our pre-made cavity, and with the help of our drill, we slowly screw it in until it is totally stable. To avoid improper tissue generation, we close the mouth of the implant with another inside screw, since it will be needed when we start building the prosthetics. When all is done and everything is in order, we close the wound by suture, and after an X-ray and checking, we declare the procedure finished. After a couple of months of healing, we can start building up the finalized prosthetics. In case the implants are in subgingival position, it first has to be liberated, making it available for impressioning. For the impression, we need to place the impressor superstructure inside the implants. We make the impression to render the place of the implants, the form, number and position of the teeth, the form of the gingiva, and many other things, making them visible for the technicians. After 8 to 10 days, the work is done, and if our patient is satisfied with the results, we finalize the finished denture. After 8 to 10 days, the work is done, and if our patient is satisfied with the results, we finalize the finished denture.